I am SREE from College of Agriculture, Vijayapura. Welcome to the lecture series of Livestock and Poultry Healthcare. Today, the topic assigned to me is strain and sprain, submitted to Dr. S Y Mukarthal. Strain usually refers to the extensive physical and mental tension, whereas sprain refers to the twist in the ligaments such as ankle, knee, etc. It usually refers to the tear in muscles and tendons. In acute case, pain, swelling and lameness is usually seen. The swelling becomes pronounced 2 to 3 days after the accident. It is not pronounced immediately after the accident. Swelling may be diffuse, extending over the entire metacarpal region, or it may be localized. Palpation of the suspensory ligament or the flexor tendons reveals the pain. Pain and lameness are marked only when the lesion is close to the joints, such as knee, fetlock or any other pastern joints. At rest, the limb is kept with fetlock and phalangeal joints are slightly relaxed so as to relax the tendons. Then moving on to the signs of the acute lameness, increased heat, changes in the shape or size, discolored spots on the sole are usually seen, abnormal wear patterns, soft swelling, thickening of tendons and hard lumps are usually seen. In chronic sprain, the pain and the lameness are slightly less, intermittent lameness is seen, enlargement and indurations are seen. Indurations usually refers to the thickening and softening of the muscles. Chronic sprain may become acute when the horse is put to work. Sprain at the level of synovial sheath may sometimes cause synovitis in addition to the tendinitis. Synovitis is thickening of the synovial membrane. Chronic laminitis, pressure on the sole from a rotation or sunken pedal bone is usually seen. Breakdown of the hoof wall pedal bond. Permanent changes in the blood supply to the hoof wall is seen. Here you can see the mild, moderate and severe cases. In the picture you can clearly see it. Diagnosis. Palpate the tendons after flexing the joints and lifting the thumb. The seat of the lesion is the point where pain and swelling are most evident. Prognosis depends on the severity of the sprain. When there is an extensive damage to the tendon fibers, the same are replaced by usually a fibrous tissue. In such cases, knuckling may result due to the citruscal contractions. Implications such as synovitis of the tendon sheaths may also result in tendinitis. Moving on to the treatment, the rest is necessary. Corrective shoeing may be adopted to preserve the normal slope of the pastern. In the acute cases, cold and astringent applications, moist horse fomentations, pressure, bandages, injection of the corticosteroids, usually like hydrocortisone acetate, a dose of 50 to 100 mg into the tendon tissue, etc., may help to reduce the inflammation. Then moving on to the tendon rupture. Tendon is usually soft muscle connecting the bone and also a muscle. Rupture refers to the tear. And in picture you can clearly see a tendon rupture. Moving on to the etiology, rupture results from extensive strain thrown on the tendon, cattle jumping on one another, and in case of horses, during jumping or during heavy draft or any heavy work or due to external violence. Moving on to the symptoms, inability to bear weight on the affected limb and flexion of all the joints. Hock and staphel joints can no longer be fixed to support the body weight. It is permanent. Consequently, collapse of the limb allowing of the back of the hock to approach or come in contact with the ground. Thank you.